separate healthcare from the economics. They're tied together. The passage of the Affordable Care Act set a brand new chapter. We were spending almost double per capita what any country on the face of the earth was spending on healthcare, and yet our health results were pretty lousy. The costs kept going up year in and year out, bankrupting states, potentially bankrupting the federal government, certainly putting families in financial risks to try and get the treatments. So a big aim of the law, which is playing out slowly over time, is how to make sure that the federal financing, the almost $1 trillion that the federal government spends, produces better results. We have the lowest health inflation now in 2015 that we've had in 50 years. And there is some promising early results in some of the transformative efforts. But it's an exciting time. Whether it was helping to round up the votes in Congress to make sure it passed the House and the Senate, not only once but twice, or talking to my former colleagues as governors about their role and what they could do, or working with the advocacy organizations, ultimately going out and selling the plan to consumers on the ground, being the face at congressional hearings, answering questions. I had a role. There certainly was a very able team, both in our department and the White House and some of the other cabinet agencies, but how to lever assets, how to manage a very complicated process, how to make sure we met the timetables and regulatory hurdles, and at every point along the way, getting input from enough people that we had enough of a balanced view that the rules and regs set a platform where private sector insurers wanted to participate, where consumers could understand what they were doing. It was a daily challenge and balancing act. And certainly I learned new things every day I was there. I learned from amazing experts. I knew some of these pieces going in, but there wasn't a day that went by that something new didn't come over the transom, and something, exciting but pretty daunting didn't become part of my portfolio.